Thanks for staying with us. We have on the couch right now Dr. Chibuki Aigbe. She's a seasoned medical doctor with over 12 years of experience in clinical and administrative medicine, currently serving as practice manager at One Wellness Center. She's also responsible for designing and implementing clinical processes and procedures. Today, we'll talk about demystifying diabetes. Hi, good morning. How are you doing?
Hi, ma'am. Good morning. Nice to be here again.
We have been demystifying a lot of concerns, health concerns
yeah.
in the beginning of the month. We demystified sexual health, demystified IVF.
IVF.
Now we are demystifying diabetes. First off, let's quickly run through what diabetes is, and then we'll talk about, give us a clearer understanding of how to manage our diabetes.
Okay, so diabetes is a disease condition where you have elevated blood sugar levels for a long period of time. Okay. So that is what it is essentially, and there are two types.
Okay.
There are two types where the body does not produce insulin. Or very, very minute levels. That's the type 1 diabetes. Before they used to call it juvenile diabetes because, I mean, we saw that for children. But now we've seen it even in adults as well. So you can have that. And then you now have type 2 diabetes where the body does produce insulin, but the body still has sugar. So what happens? The cells in the body is not able to absorb that sugar. So it's just, freely moving in the body. Yeah, so those are the two major types. There are other types, okay? Like so those are the two major types, but there's another type called the gestational diabetes, okay? And that happens when a woman is pregnant.
Yes.
She may, after pregnancy, the diabetes may not resolve. It might transcend further into diabetes if you have other risk factors.
And what about the mature onset diabetes?
Okay, so that is that type 2. So before you would hear juvenile diabetes, mature onset. However, now the time of onset of the diabetes doesn't matter these days. It's now more of, is there insulin, is the body producing insulin? Is the body not producing insulin? So those are the two major types. That is how you differentiate the two types.
Let's talk about the signs quickly, because I'd like to imagine that there are people living with diabetes and they don't know that they are living with diabetes. Also because they're not paying attention to how their body is responding to some of the, some of the signs. And so talk to us, how would I know if,
First and foremost, there's tiredness. It's a very vague symptom, tiredness. So most people will say it's the stress of Lagos. I mean, if you're tired for so long, go and check your blood sugar. So there's tiredness. There is
when you say
always
tiredness, every single hour of the day.
Yes, you're tired, and I'll tell you why.
Okay.
You're tired because the sugar in your body is just there. It's not
being
entering
used.
Exactly. The body's not being. It's not absorbing. So you're tired because you really don't have sugar to function. Okay. And then if you test it, you see that the sugar is high. So the way the body was made is like so many other hormones and so many other chemicals in the body. Okay. When one increases, one reduces. There's a maker-checker balance thing. And also that happens with glucose. So if the glucose is high, there's a hormone that is produced. If it is low, there's a hormone that is produced. But with people in diabetes, that transitioning, that playing around the hormones is broken. So you would always just have it perpetually high.
Okay.
Or you have it low, because if you take your medications and it drops. So yes, you're tired because maybe it's too high or it's too low.
Okay.
And then you have drinking water. You're excessively drinking water, and you're excessively thirsty. And because you keep on drinking water, you keep on peeing.
Okay.
You keep on peeing. I've had a patient who presented in her 40s, and apparently she was diabetic, but apparently she didn't know because she had been diabetic for years.
Does it show in your pee, though?
Exactly.
In the
what
color
happens?
of your pee?
No. So I'll tell you what shows.
Okay.
As a child, she remembers that aunt used to gather her pants.
Ooh.
Exactly.
When she washes it?
No, her dirty pants. When there's pee on it, so she just used to see ants around her pants. So she never knew that, okay, so this is sugar. So ants, sugar now, ants and sugar now,
true,
exactly.
True.
So in people who have very unmanaged diabetes, their pee froths. So they foam like beer. Do you understand? When you pee, so yes, it could foam. If you pee regularly because of the force, it could foam. But it's
when
not
it's
frothing.
abnormal, when it's
and that means that you're already having a little kidney dysfunction there. Okay, so it's frothy. So that's the physical change. But yes, so you're peeing, you're drinking, you're thirsty, you're also hungry.
Always hungry?
You're hungry, you're eating. Do you understand? Because your body is, something your body is telling that you don't have glucose, you don't have sugar. So you keep on eating and you keep on losing weight. Do you understand? So those are the, so you're losing weight, you're constantly eating, you're constantly thirsty, constantly peeing.
And you're always tired.
You're always tired. So that's the common signs.
We have to wrap this up quickly, but can diabetes be reversed?
No. However, diabetes can be managed.
Okay.
There's some people who we say they are pre-diabetic, okay? Meaning that you don't enter express road, though.
Yeah.
There and there, family lifestyle changes can help you, not reverse, but stall it. Okay, so if you catch it quick. However, if you have a full diagnosis of diabetes, it can be treated, but it can be managed.
Okay.
If it's a type 1 diabetes where the cells of the pancreas are not producing insulin, then you can do, we don't do it here in Nigeria, Sha. You can do like a pancreas transplant where, because that's what the problem is.
Yeah.
Meaning that if insulin is provided in the body, then the sugar will drop.
Yeah.
I would not do this topic, justice if we don't talk about the complications very quickly.
Okay.
Just know that in diabetes, every part of uncontrolled diabetes, every part of your body is affected. From your brain, you could have strokes, you could have, because they go hand in hand, it goes hand in hand with hypertension.
Yeah.
You can have depression in your eyes, you can have diabetic retinopathy that can lead to blindness, okay? From in your mouth, you can have sores in your mouth, tooth decay because, issues. I'm just trying to really wrap it up. Your skin, you can have rashes, you can have blotches, your kidneys, your heart, everything, your feet.
You have swollen feet.
You have swollen feet, you have sores that never go away because it's not getting enough blood and the nerves that they're supposed to help heal. I'm really trying to really break this down, so you would have unhealing sores and all of that.
I think that we need to revisit this topic again
it's
because
huge.
it's really broad. I mean, recently I saw a video of someone saying that guava leaves could actually help to prevent or sort of help to manage your diabetes. So there are lots of, hypotheses here and there, to sort of help people.
Myths.
Myths, I would say. Okay, myths, if you say, because some of them call themselves herbal doctors, but then we never know. But we'll revisit this topic again next week. But thank you so much for at least doing some sort of justice. I know someone watching right now would, pay more attention.
There's some awakening.
And there's some awakening. Thank you. And we'll take a wrap right here on the health segment. We have a guest coming right up. Stay with us, people. The show continues.